Hey y'all, it is Dr. Nicole, the Black Woman's Confidant.
And I'm Dr. Tracee, America's birth surgeon.
I know y'all are probably wondering what in the world are Dr. Nicole and Dr. Tracee up to today. And this is just a little series we cooked up in our heads because it's necessary, because the world needs it. And y'all know
Absolutely.
we here for the people, right?
We are down for the cause.
We
And the
are, we
cause,
are. We
yes, we are always down for the cause. And boy, let me
we
tell you, nothing but lifing can bring two kind of yin and yang people together, but it has.
Don't let Dr. Tracy fool y'all. She is yin and yang all in herself. She is
Yes.
she is all within herself, yin and yang. But we decided to do this because over the last several years, I mean, aside from being colleagues, Dr. Tracy and I are really good friends, and we have shared all of our personal struggles with each other. And one thing that we both have in common over the last several years is helping our loved ones navigate the healthcare system, and it's complicated. And at various points, we would say things like, if we are whole doctors out here struggling with this system, how in the world
Yeah.
is everyday person supposed to understand this system? I was helping my dad navigate the system. Dr. Tracy continues to help her parents navigate the system. And all of those encounters, we can each point out things where it's like, oh, this didn't go well, that didn't go well. And it can all kind of be redirected back to misunderstandings or people not understanding the system and things like that. And so while I completely understand, and I'm going to tell you, I'm not about to sit here and tell you the healthcare system is fantastic. And I'm not going to sit here and tell you that there is not bias against people that look like us every day in the system. I will say we can arm ourselves with the knowledge that we need to try to make navigating this painful system a little bit easier.
Absolutely. 100% agree.
So we decided that the very first one we were going to do, we were going to talk about just how to prepare for a doctor visit. Just how to prepare. Do we just say I'm going to the doctor and don't think about it until we get in the waiting room? Or is there a list of things that we can do to help us really make the most out of that visit? What are your thoughts, Dr. Tracy?
Oh, absolutely. I think one of the biggest things, and maybe it's from the fact that remember, let's start with the basics of maybe you made that appointment 6 weeks ago, 3 months ago, maybe a year ago. You should not just be thinking about what you want to talk to the doctor about the day you show up for the appointment. So I think the first thing we can probably talk about is how do you prepare for the visit? What do you think? Is that a good place to start?
Yeah, no, I think that's a fantastic place to start.
Okay, so personally, I think that we need to approach a doctor's appointment just like you would a great grocery list or a trip to the grocery store. What do you have to do to save the most amount of money and be the most efficient in a grocery store? You make a list. And in this situation, I want you to write down what we in medicine call a chief complaint. Now, that does not mean that is your only complaint, right? Because you might be at the doctor's with four, five, six, seven things. But truth be told, that appointment is 12 minutes long. So I say you go in strong with that chief number one priority complaint, and you're going to write this down about 2 days before you have to have your appointment. What do you think?
I, I also think it's good to have other things on that list if they're priorities for you. But I like to encourage people to put the list in order of importance. If you have six things, you honestly may not have time to get through all six of those things. But if you put that list in order of importance, and if you walk in there and your list is together and you are ready, you may be able to get through two, three of those things in that visit if the time is
That's
used
true.
well. So you could get through them and you already have them written out. Because what I see most often is we'll talk about one thing and I'll say, okay, is there anything else going on? And people go, and their mind draws a blank because now you're on the spot and you're like, yeah, there was something. And then when do you remember it? At the end of the visit, when you checking out up front, when
In
you
the
in the
car,
car.
in the car on your way home.
You turn the wrong way and that side, so you go, oh, I meant to tell him about when my side hurts when I turn the wrong way. So, I think having the list and putting it in order of what is most important for you to cover in that visit is going to help you out tremendously.
Actually, absolutely. And then I would also, so, one of the things that Dr. Nicole mentioned was, in the list of priority of what is most important. And so what sometimes can be hard to differentiate is what is the most important, right? So this is when it comes down to what may be the newest complaint. So let's say you've had diabetes for 10 years, it's been going strong, you're on your meds, your A1C is where it's supposed to be, but you just started having chest pain. Chest pain kind of becomes the number one, and diabetes becomes the number two and number three.
Hmm.
Or let's say you have some acid reflux or you're not sleeping at night. Those are the things that might take precedence over a complaint about some foot pain. So only you know what bothers you the most, but I would start with that list of the things that are the newest, not necessarily the things that are the most chronic.
Yeah, that's a good point. And they do normally ask you, the nurse who rooms you, whatever staff that rooms you, will typically ask you, what's going on today. They may even ask you about, have you had any chest pains? Have you had any pain, aches, shortness of breath, that kind of stuff. That's really a time for you to set the agenda. So you have a little bit of pull in how that agenda is set, because a lot of times what you tell that person when they room you is what is documented, and that's what the doctor sees first, because they're going to look at, well, what did the nurse put down before they walk into the room. And so I know a lot of times people will not say what really brings them in to that initial person, because they think, well, oh, I'm just going to tell the doctor when they come in. You want to set the agenda, and you can have a lot of power in agenda setting by telling that person, oh, I'd like to talk about this shortness of breath I've been having, and I'd like to talk about this pain in my side that I've been having.
You brought up a key point. One of the things that I notice is people say, "Oh, I'm here for my annual." That probably should not be the thing on your list. Because when I walk into an appointment and I'm like, "Oh, this is just going to be a regular check-in visit," you then get kind of classified in the, "Oh, we're just following up old problems," right? We're just going to follow up labs. We're just going to, and so you do not get put in that bucket of we may have to give more time to some new problems. So again, sort of similar to what Dr. Nicole mentioned, where you're like, don't just say, I'm here to see the doctor. Come with a, I'm here to follow up on, I'm here because I've been having,
Mhm.
not just the, I'm here for an annual. The other piece, just as a an FYI, especially in the realm of like gynecologic or GYN issues, if you booked an appointment under an annual, there are no conversations about actual problems. And the reason is insurance driven. So insurance for some people will pay for the preventive screens, but they will not pay for problem visits. And so
Mhm.
now if you go for an annual, but you
Mhm.
start talking about problems, that visit may not be covered the way that you would like for it to be covered. So be
Mhm.
honest when you're setting your appointment so that you're put in that right appointment time so that you can talk about the things that you know are important.
Yeah, and sometimes you did set it as an annual. Maybe you are going to see your primary care doctor. You saw him 6 months ago, and you'll notice a change, a shift, I guess, in culture based on insurance and payers and things. I notice now that when I go see my PCP for routine follow up of just regular things, they'll ask me, do you want an annual exam or do you want a follow up visit? And that is a new change. I didn't used to get that question when I would go to my primary care doctor. They wouldn't ask me that. I would just schedule a visit for every 6 months or 3 months or however long. And it was just that. And now it's like, do you want? And even me as a doctor, I pause. I'm like, I don't know what I want. Like, I don't know if I want to, I don't know what I want. What do I want? And it's because the insurance companies will pay like a certain amount for problem visits versus an
Exactly.
annual H&P, an annual exam visit. And so a lot of people will get really frustrated. So I end up hearing a lot of people's frustrations about their doctors. And so they'll come back and they'll say, man, I saw my PCP and I had an annual scheduled. And about a week beforehand, I started getting this weird pain in my leg. And when I went in, they wouldn't address the pain in my leg. They said I had to come back. And they get so mad at the doctor's
Yes.
office. And I know, I get it. I mean, it's very frustrating. You took off for this, you had to travel across town. Yeah, I get all the stuff. But know that a lot of these issues are driven by insurance
Yes.
companies and regulations and things and changes to that. Because that didn't used to be like a thing. That didn't used to be a thing.
Right. Oh,
So
absolutely.
yeah, that wasn't a thing. Like, I mean, that didn't used to be something. So now it is, and it's something you need to be on top of. And just know about one, because it can just save you frustration. So when you show up and you say, "Hey, I know this is a physical exam visit and we're not supposed to talk about new problems in this visit, but I do have a new problem." And for me, that new problem is trumping this need to have this annual exam. You can ask, can we reschedule the annual? Can we reschedule that exam? Because I really would like to cover these things. And that
Right.
will help instead of kind of getting upset. I think that is also important, Dr. Tracee, to not just come in with a complaint, right? So let's say
Correct.
my stomach hurts, right? I think it's I think it's helpful to not just come in with my stomach hurts without really being able to think
A
about
hundred
what are
percent.
you describing, right? Stomach, we say my stomach hurts. I mean, your stomach is an organ. It's in one space in your
Correct.
abdominal cavity.
Correct.
There's a lot of organs in there. And so there's a lot of things that could be hurting when you say, "Oh, my stomach hurts." And
Correct.
depending on the quality of the information you give, that is what's going to help your doctor be able to know what organ they think it is, what the diagnosis could be based on the pain and the issue and where it is. So I think for any complaint, my knee hurts, my leg hurts, I got a
Hmm.
headache, I was nauseous, like any information you can give is gonna be helpful, right? I mean, I'm over here in psych.
Absolutely.
I'm over here in
Absolutely.
psych, girl.
Look, when you started talking about visits and how we could get six in, and I'm like, in my head, I was like, y'all not getting through six things on a list unless you come with all the details. And so you absolutely hit it. So, for example, Dr. Nicole was talking about stomach pain. I have a classic example in my own father. So my dad calls and he goes, "Baby girl, my stomach been hurting." And I was like, "Okay, like when you say your stomach, like what do you mean?" And I was like, "So is it like around your belly button? Is it like on the left side? Is it on the right side?" Because remember, most Americans, when I say stomach, that means my abdomen, the whole abdomen. The abdomen being the thing between your nipples and your private parts. People will call their stomach. But in medical, right? Yes, medical is its own language. The stomach is not between your nipples and your private parts. There's a whole lot of organs that can cause problems that get lumped into stomach. So what I would recommend in this, like taking that inventory of what am I going to talk about, is I want you to truly think through what is the pain. So don't just say my stomach hurts. What kind of hurt? Is it like gas pain? Is it like a hungry kind of pain? Is it a burning pain? Is it a stabbing pain? Does it come and go? Does it only happen when you eat? Does it only happen when you don't eat? Right? There are so many characteristics. Is it do if I push, can I make it hurt again? Right? If I twist a certain way, that's the only time because that let me help you. We are interpreters. Like we are like what's the word when I know multiple languages, whatever that is, that's what we are. Because we speak English, we speak medical, and we speak Black Ebonic slang. We can even throw in a little bit of that like New Orleans Louisiana flair. So we know like four languages right off the bat. Because I've got to understand when you tell me I got a pinch of this, that just means a little bit, right? And so like when the stomach hurts, I've got a little bit of the crud, I've got a little gras I've got a little like all those things. We have to be certain that we're speaking the same language. And so when
Hmm.
you come and you can explain to me about your complaint, one, it saves you time.
Hmm.
So now you can get through more than one visit. And it helps to minimize being misdiagnosed. Because
Hmm.
here's what I'm going to tell you. If you're going to a doctor who only speaks medical and they barely are getting by on English, you're going to have a visit where you feel misunderstood because they did not understand.
Hmm.
So if
Hmm.
you can come and you're like, when I eat this food, I get a pain right here on my right side.
Hmm.
That it goes a whole lot farther than
Hmm.
saying my stomach hurts. Oh yeah, it happens almost every day. It's night and day. Like your diagnosis differential, the images that you're going to get, the labs that might get drawn, all of those things are dependent on how well you can describe what
Hmm.
your pain is,
Hmm.
right?
Yeah, as many details as you can give about whatever your complaint is for that visit, as many details. How long has it been around? Is it every day? Is it intermittent? Are there things that make it better? Are there things that make it worse? Whatever observations you've made, and really like pay attention to your body and make the observations. Pay attention to what you're feeling. How long is this pain lasting? Because people often will sit there and you say, "Well, how long does it last?" And they're like, "Oh, feel
It's
like
been a
forever."
minute.
Feels like forever. It's
Right.
oh, it lasts a minute. I don't know what that means. It could be I don't know. We talking about black people here. It could be it
Exactly.
lasts 5 hours. Oh, it's a minute. Who knows? But if you're talking to the wrong person who is not a polyglot like Dr. Tracee said,
There we
and
go. A
and
polyglot. Like I know.
and doesn't speak black folk, they might not understand that a minute is not literally a minute. So we want to make sure that it's clear and if you can provide as much information as possible. So in addition to like just the thing that you want to talk about in that visit, I think we should talk about a couple of things preparing for a new visit, like a visit with a new person. And some of this stuff I
Mm,
guess isn't necessarily even unique to new visits. So when you think about your medication list, accuracy in your history, we may see doctors for a variety of issues, and you may have your primary care doctor, you may have a couple specialists involved in your care. And unfortunately, our systems don't always talk. They just do not
no.
always talk. And even when they do, they're not always accurate. So oftentimes for medication lists, a system may pull up like every medication you've ever been prescribed over the last year. And you're talking to a doctor and they're like, "Are you still taking this antibiotic?" And you're like, "No, I haven't taken it in 6 months." "Are you still taking this eye drop?" "No, like I took that for a week a year ago." And patients get so frustrated. People get so
Oh
frustrated
yeah.
about us asking, is that not up to date?" And it's like, well, I mean, it's this is what I have in front of me. And so in effort to be efficient, I think these symptoms will pull from these centralized databases of your prescription history, your prescribing record, but it may not always be accurate for what you're taking right now. And it is also true that you may not be taking something that you're supposed to be. Somebody may have prescribed something to you. And if I'm your everyday, your regular PCP, and I see you every 3 months, 6 months, I may not be aware of what random specialist person. I may not know what Dr. Tracee put you on. I may not know what the psychiatrist put you on. And so I encourage people to always keep an accurate
Yeah.
list of their diagnoses, any family history changes, and any medication to take with them. Is that a pretty good list of like history kind of
Absolutely.
things to have?
Absolutely. And I would go a step further and say that you should carry in your wallet that list for everyone in your household. And the
Hmm.
reason I say that is how many of our black men are actually the primary drivers of their health care? They're not. Their
Hmm.
wives are. So now what happens when the wife is the one who's sick? The husband is clueless. So if you could now say each of us are going to carry these lists, you can
Mhm.
put the husband on the front, the wife on the back,
Mhm.
then that goes a long way. For example, a patient pulled out a med list the other day with me, and they were like, well, I think he's on these medicines. And at the top of the med list, the date was 2019. They had not updated the med list in 7 years.
Mhm.
So, yes, keep a list, but keep it accurate. I'm not
Mhm.
saying you need to update it weekly, but I mean, we almost didn't make a decade on that med list, you know? So, I mean, let's say every 6 months we're going to make an update. And then
Yeah.
I would go a step further, Dr. Nicole, and I would say we need to be honest. So I think a lot of times patients feel guilty if they're not taking the medicine that they're supposed to take, but it's still on the
Mhm.
med list, right?
Mhm.
If you're not actually taking the medicine, let the doctor know because
Mhm.
they're going to make suggestions and changes based
Mhm.
on what they see on that list. But if you're not taking it, then they can't make a real assessment and
Mhm.
real changes. I've
Mhm.
got a funny story. Can I share it?
Yeah, yeah, go ahead.
Okay, so my grandmother, who has since passed, I've been helping my parents advocate for her before she started like really declining, and so she was on a medicine for high cholesterol. And so she was at the doctor's appointment, and I'm on the phone, and the doctor is like, well, your numbers just are not going down, and we've now increased your medicine 3 times in our last visits. Are you having any problems with the medicine? Or is it causing any cramping? Have you noticed any changes? He's like, because we really can't go up anymore. We may have to change medicines. And my grandma's like, no, no, I don't know. And so my mom's just sitting there quiet, and I'm on the phone clueless. So the doctor's like, well, we're going to change medicines. He sent a new medication to the pharmacy. And my mom calls me when they get to the car, and I was like, Grandma, so what's going on with your cholesterol? I thought y'all changed the diet. I'm not taking that medicine. This
Grandma.
whole time, she had not been taking the medicine and let this man increase the dose for the past 3 visits and had not once taken the medicine. She was like, I took that medicine once and didn't like how it made me feel.
Grandma.
You
Grandma.
can't be like my grandma. Like, if
Grandma.
you're not taking the medicine, tell them, I'm
Yes.
not taking it. This is why.
Yeah.
Maybe you started having some muscle cramps. That says a lot. That means that maybe this class of medications doesn't work well for
Right.
you. So now we can take it off the list, put it in your record, and try you
Mhm.
on something that actually works but won't
Yeah.
cause those same side effects. I was
Yeah.
like,
No, that is
oh,
that is funny and maddening at the same time because I have I can laugh at it because it's like, oh, grandma. But on the other side of that, how frustrating is it for you as the doctor to adjusting something that they aren't even taking? And
correct.
you're like, why are we doing this? Why are we playing this game? She's like, no, I'm not having any problems with it because I ain't taking it. That's why I'm not having any problems with it, tolerating it because I ain't putting it in my body.
Yeah.
That is important. And you know that point about the list and reconciling the list. I was just telling my husband probably here in the past few weeks because it occurred to me he is very much in charge of his healthcare. Like I don't have anything to do with his appointments and all his stuff. But I also realized that means I don't know his med list. And so if there was an emergency and he ends up, in an emergency setting and they call me and they say, "Hey, what meds does your husband take?" I'd be like, I don't know. I don't know. Call his doctor. I have no idea." I would not know.
Right.
And while I don't feel like just because I'm his wife, I should be, in charge of his healthcare, I agree with you. We should have each other's lists and be able to provide that information because life happens. Like there are emergencies that happen. But it's also not
Absolutely.
just medications, prescription that we should be keeping up with. You also need to make sure you share over the counter drugs. And you also need to make sure that you're sharing supplements
Yep.
and as much information about those supplements as possible. If you're taking magnesium, if you're taking ashwagandha, if you're taking whatever it is, make sure you
Testosterone.
know. Hmm?
Testosterones.
Yeah, oh yeah, oh yeah. The other things, yeah, like that, or these I go for in psych. I get a lot of people taking these memory enhancing or cognitive enhancing supplements, and they have no idea what's in them, and they'll say, "Oh, it's a bunch of plants." Ultimately, it ends up being something caffeine like that is a plant, and it
Mm,
still can do the same thing. And so I need
right.
to know that. So I would say, if you're taking anything over the counter, supplements, whatever that looks like, make sure you share that because those things are equally important. So, did those things change? And also that family history. If you had a close relative die from, a sudden cardiac event since your last visit, you want to make sure you update that family history with your doctor. I remember when my father passed away, and it was a suspected cardiac event, and I was telling my cardiologist, and they were like, "Oh yeah, we should probably get a stress test for you. We should probably just get it, based on that family history." And so I got the stress test, but those are things that they would not have known to even be on
Right.
guard for had I not shared with them that I had a change in my family history. So I think
That's a good point.
those are things that we don't always think about, but they're pretty important.
Yeah. Although I'm sure in the psych space, in that a lot of those psychiatric diagnoses
Mhm.
run in families.
They do.
So like if I'm a parent bringing my child, maybe the best piece of information I could also add would be what's my husband's family's psych
Mhm.
history as well as what's, my psych history. I mean, I would
Yeah.
think that would play a big role.
It does, but people, especially Black folks, we don't know people's psych
Oh,
histories.
that's
I
true.
mean, unless we're in a very open family, or we just kind of know. What I get a lot of is, no, I'm the first. I don't have any family history, or I get a lot of, well, nobody's been officially diagnosed, but I have my suspicions. I get people telling me about, their random auntie or uncle or great auntie or great uncle who lived with their grandma who never came out, maybe came out for holidays, who was
Mm,
kind of a recluse, who was very different, eccentric. I get those kind of stories, but it is hard for me to get like actual
gotcha.
history, especially when it comes to our folks, because we just don't have it. And just because you think, well, nobody else in my family has ever had anxiety, I don't think I have it. But your auntie and them stay talking about how bad their nerves are.
It's true. That's true.
They stay talking about my nerves bad. Y'all making all that noise,
Hmm.
and y'all know my nerves bad. They don't
Yeah,
know. Nerves bad is not an official diagnosis.
that's true. And think
But yeah,
about how much drug and alcohol in our older
yeah,
generation may have been
yep,
self-medicating
yep,
because there was no diagnosis. So you're
right,
right. You're right.
right.
I get that a
So
lot with
sometimes
my
it's
HS
hard.
patients.
But even the behavior is important. Even the behavior is helpful to know. Because Dr. Tracee and I had such an extensive discussion, we felt it was best to divide our conversation into two segments. Be sure to tune in for part two, where we will dive into strategies for maximizing that limited amount of time you have with your doctor, effective ways to advocate for yourself during a medical appointment, the vital role of trust within the doctor patient dynamic, and best practices for concluding your visit and clarifying the next steps in your care. Make sure to join us for the second half of our talk.